Hi, I'm Rachel Wall, founder of Inspired Hygiene. I have a quick video tip for you. So this is actually a follow-up from a video I shared recently where I was speaking at the ADA, and I was talking about the AAP statement paper where they share that x-rays routinely underestimate bone loss. And this is no surprise to us, but what's really interesting is they say that up to 30% of bone density must be lost before we can ever visualize the bone loss on digital x-rays. So how this shows up for you on a day-to-day basis is that you may be seeing all the clinical signs of active periodontal disease, but the x-rays may prove inconclusive. And then sometimes when we submit those x-rays with that initial claim to get help our patients get their benefit for periotherapy, that can be denied. And it can often be denied assuming that the x-rays are of diagnostic quality and all the bone is visible. Sometimes they're being denied because it's simply the x-rays are inconclusive and they're not supporting your case. So here's a quick tip. I learned this from Lois Banta, someone that I trust and I've learned so much from over the years of Banta Consulting. And Lois' tip is on that initial claim for scaling root planning, don't submit the x-rays unless they are very obviously supporting your diagnosis. Now, this is not deceptive. You're still going to send your complete periodontal charting with bleeding points, recession, mobility, anything else that supports the diagnosis. I can't encourage you enough to send clinical photos. Send photos of that bleeding. Send photos of the recession and of the inflammation, right? Send your clinical notes. And by all means, let that third-party payer know of this patient's medical risk factors, right? These are things that can increase their chance of progression of periodontal disease, and also things where periodontal disease may increase the chance of progression of these medical issues. So I would encourage you to try this. I've been sharing this and I've been getting a lot of good feedback. A lot of teams are actually doing this and doing this with great results. So I would encourage you. And then, of course, if the claim comes back and they request the x-rays, you'll send them. But the tip is to maybe not send those x-rays on that very first claim and see if you have a bit more success with that. So thank you so much, and I'll see you next time.